Thank you, Thank you, Minister Feehan, for being here today. I would have liked to see Minister Donnelly here himself to discuss this very important matter and answer the questions that I've put down. In March, I raised this issue in this House about the state of telemedicine provisions for abortion in Ireland and the risks surrounding its operation. Telemedicine abortion was introduced in March 2020 as a temporary COVID-19 emergency measure. While virtually all emergency measures have been pulled back, telemedicine abortion remains in place with no signs of the Minister of Health seriously committing to putting it back. This is regrettable, as there are serious acknowledged risks associated with telemedicine which must urgently be addressed. I raised some of these in my contribution on the 1st of March. I am aware that the Minister of Health ordered a review of the revised model of care for termination of pregnancy in Q4 of 2021, which took a largely positive view of telemedicine abortion and valued the convenience it offers for women having an abortion. However, I must stress that these are considerations more important than convenience and ease of access, such as the physical and mental safety of women and girls in this country. As such, how can the Government stand over the acknowledgement from the HSE in reply to a parliamentary question that meeting the woman in person increases the likelihood of the provider identifying any coercion or domestic abuse, yet continues to operate a policy which facilitates the abuse of vulnerable women? I understand the Minister is considering a blended approach for telemedicine, which would allow operational in-person consultations. But under this proposal, the most vulnerable women would inevitably fall through the cracks. Women suffering from domestic abuse, coercion and those trapped in human trafficking would not benefit from a blended approach. It cannot be seriously argued that the abusers would permit their victims to opt for an in-person consultation over a remote, impersonal phone call. Moreover, a phone call is a complete inadequate substitute for an in-person consultation and examination, and there is no way to guarantee a woman's privacy in a phone call scenario. Recent findings from a BBC 4 poll reveal that 15% of women between the age of 18 and 44 in the UK have experienced pressure to go through with an abortion they didn't want to have. Continuing to allow telemedicine at home abortions would continue without the requirement of a face-to-face consultation for such an important decision, leaves open an extremely likely probability of women being coerced into having abortions by a malign influence of a partner or a third party. How does the Minister plan to address this alarming probability? Clearly, the Minister, whatever you're having yourself attitude, is a blended approach, fails to adequately redress this alarming issue. I fail to see how telemedicine abortion, including even a blended approach, could accurately verify a woman's gestational stage. If a pregnant woman were beyond 9 weeks or 6 days and had inaccurately self-assessed her last menstrual period, she could receive and self-administer abortion pills which could impose immense health risks. Moreover, there is no way to guarantee a woman would take the pill at home as soon as they are received. Situations like these could lead to complications like hemorrhaging, infection, incomplete abortions and ongoing pregnancy. I cannot see how telemedicine, either in full or in a blended approach, would adequately address these risks. So I'm calling on the Minister to acknowledge the realities of the situation. People's lives are in danger here. Women in abusive situations are being utterly failed by telemedicine abortion. He cannot continue to live in a bubble where the only issues surrounding abortions are how easily and convenient it has to be to have one. The argument that this measure is a temporary COVID response is increasingly losing its relevance. So, Minister, you need to address these very serious matters and ensure that this full return to mandatory in-person consultations for women seeking abortion. Thank you.
Thank you, Senator. Minister, you have 4 minutes to respond.
Thank you, and I want to thank you, Senator, for raising this issue, and I'm taking this commencement matter on behalf of Minister Donnelly. And the model of care for termination of pregnancy service became operational in January 2019, following the enactment and commencement of the Health Regulation of Termination of Pregnancy Act 2018. Termination up to 9 weeks gestation is carried out in the community by GPs or by doctors working within family planning and women's health clinics, providing clinical supervision and supporting women's self-management. Women with a pregnancy between 9 and 12 weeks gestation are referred for hospital-based care. The arrival of COVID-19 in 2020 required a substantial shift in how care is provided across the health service, including the adoption of measures to facilitate social distancing, reduce personal contacts and footfall within medical facilities as appropriate. As part of the health system response, a temporary revised model of care for the termination of pregnancy services was agreed to facilitate remote consultation with a medical practitioner for the purposes of accessing termination in early pregnancy. The revised model of care stated that face-to-face consultations could be held if clinically necessary, but that such consultations should be kept to a minimum. It is recognised that the current public health guidance, including guidance on managing risk of transmission of respiratory viruses, including COVID-19 in general practice, continues to apply and advises limiting footfall through the practice by discouraging unnecessary attendance at the practice by people who can be dealt with equally well by telephone. As wider public health restrictions begin to ease in 2021, the Department requested the HSE's National Women's and Infant Health Programme to undertake a review of the operation of the revised model of care for termination of pregnancy services from a clinical and patient safety perspective. The purpose of the review was to consider whether the revised model of care should be retained going forward. The review was completed and submitted to the Department, and having regard to the experiences during COVID-19 and the review work undertaken, consideration of the model of care is currently ongoing.
Thank you very much, Minister. Senator, you have a minute to respond.
Yeah, thank you very much, Minister. And I suppose really I wasn't expecting anything else, to tell you the truth, from the Department. Very disappointed. I understand the review is ongoing. I'm unfamiliar how long it takes for them to come with the conclusion to the review, or when will they print the results of the review. You know, there's clearly there is safeguarding issues here, specifically coercive control and domestic violence, and there's also you know, difficulties identifying the gestational age when it comes to telemedicine. You know, there's side effects to these drugs and pills. You know, healthcare for abortions is not something that should be given through telemedicine. It's not something that can be ordered online like Amazon or like a fast food. That is not what abortions and healthcare for women is about. So the sooner we get back to in-person consultations, the better. It doesn't serve women well to have telemedicine available through abortions, particularly women that are in vulnerable relationships, coercive relationships and domestic abuse. So I'm looking forward to seeing that review, when they're going to print it, and I'll be back to you in September again, and hopefully Mr Donnelly will be free the next time. But thank you very much this morning for coming in.
Thanks, Senator. Minister, you have 1 minute to respond.
Thank you again, Senator, and I don't have a date of when the review will be announced, but I will follow that up within the Department. And as you know, timely access to care as close as home or the community as possible is a key principle of the vision of Sláinte Care, and a review of the changes to the termination of pregnancy model of care adopted during the pandemic is an appropriate and timely initiative. The Department is continuing its engagements with the HSE regarding the final considerations related to this review and the next steps, and the outcome of the review will be made available once the deliberative process concludes. And in the meantime, it is important to reflect that the temporary model of care, along with the relevant public health advice, remains in place. And Senator, you've raised a few issues regarding your views, and I will bring them to the Minister and the Department after this. Thank you.